Do you remember your last visit to the hospital? Maybe you might remember being given a vaccine, or even cleaned or comforted by a hospital member before surgery. Chances are that that person was a nurse. With such a large variety of duties these workers do, how do we even identify them as? What exactly is a nurse? To answer that, let's take a walk through history. As the 1800s ushered in, nursing practices were generally unclean, and while procedures did help healing, secondary health problems like infections were often fatal. That fact went unrealized throughout healthcare for quite some time until one young nurse took observation. Arising from a noble family, Florence Nightingale took up her divine calling to become a nurse, where she helped establish the foundation and standards to the modern nursing community. One of her many teachings was the environmental theory. A caretaker must alter the current conditions or environment to better aid the patient's recovery. This was a very patient-focused method that became the heart of a nurse's ultimate duty. While not only helping with the needed sanitation of her era, her teachings identified what a nurse should provide. This became the responsibility of a nurse to provide quality care that values and caters to their patients in terms of emotional and spiritual being, not just physical. These values are still carried in today's nursing practice. Now that we understand what a nurse is, let's cover the specifics. As was defined by Nightingale, a nurse must be a quality caretaker doing anything in their power to help and heal their patient. To do that, a nurse must have a wide range of medical knowledge to accomplish tasks to uphold essential duties, such as being able to assess and observe symptoms to report to doctors, being educators for patients and families, being able to treat and prevent illness, being able to treat others with equipment and other medical tools, and the list goes on if a nurse specifies in a certain field. Especially in the past few years, as hospitals dealt with the COVID-19 pandemic, nurses have become the front lines of saving the lives of many under their care. Balancing their variety of duties and thanks to the foundations placed by Nightingale, nurses have become the backbone to the healthcare system. So next time you see your nurse, make sure to give them a thanks.